And next up, we're going to talk more about diversity and inclusion and go into some more nuances of some of the real keys that are needed within the digital health ecosystem and certainly healthcare overall to achieve health equity. And obviously, we're a long ways away from that. And to discuss that will be HITLAB's own Director of Medical Affairs, Dr. Prem Sreenivasan, and he will be talking with two leaders in the industry about this. Prem, thanks for joining us today.
Yeah, hi, good morning, Stan, and thank you so much for the introduction, and delighted to participate in this session, which is the real keys to advancing, achieving health equity. We have two wonderful guests. We have Fran, who's president of Reach Thought Leadership, and Mazin Gadir, who is a healthcare management consulting partner for digital health and innovation director at IQVIA. He's located in the Middle East, and Fran is located in the San Diego, California area. So we truly have a proper global feel for this upcoming session. So as we get started, both Fran and Gadir have attended the why and the HIM sessions. So Fran, would you like to start by giving us a brief intro to yourself, your organization and roles? And then we can follow that up with Mazin, please.
Sure, I'd be happy to. So first off, thank you so much for having me. I'm Fran Ayalasomayajula. I'm the president of Reach, which is a global social impact organization. I'm also the chief executive officer of RTL Innovation. It's focused in on consumer insights directly within the healthcare space. It's a pleasure to be here today.
Yeah, welcome. And Mazin, perhaps you could tell us a little bit about yourself, where you're from, and interest in the organization.
Sure, absolutely. My name is Mazin Gadir. I've been in the digital health space for the last 22 years. My background, I come from an engineering background where I did my PhD in quantum electronics and nanotechnology. And I've been working in a number of capacities in the digital health space, driving digitization and health informatics in this part of the world, from all the way from the UK to Africa, Middle East, South Asia, and going as far as Australia. And now currently I work as a partnership director, a strategic alliances and partnership director for IQVIA Africa, Middle East, South Asia, covering around 57 countries in this part of the world. And I'm very associated also in a number of volunteering positions across the region and with the US as well.
So from your vantage point, Mazin, could you tell us some couple of key takeaways, particularly as you attended the HIM session, that pertains to achieving health equity, particularly from the standpoint of some of the communities that you serve?
Sure, absolutely. So I think this being my sixth HIMS in as many as I think 6 years that I've attended, or 7 years that I've attended, I believe the one of the most kind of critical areas that I've seen specifically in the health equity is the use of technology to drive and implement use cases. So, for example, when I was in the interoperability forum in the HIMSS Orlando, I was very impressed, number one, with the use cases that have become more attained to the, or more relatable to the actual current situation. So, for example, there was a use case on human trafficking and how the technologies from different vendors are actually put together, are driving the flow of that use case being able to be utilized for track and tracing, for humanitarian cases, which is again in line with some of the issues that we have been exposed to in this part of the world. Also, the use of technology to resolve and look at social determinants of health, or catering for people of determination, specifically in our region, where we can learn a lot from the use cases we have seen in the US to serve people with special needs.
So Fran, you have a very distinctive, you attended both these conferences. So I think we're going to seek from you perhaps some key takeaways that you heard at both events, and what were some contrasts or other things as you attended these two programs, and that you're able to share with this audience today.
Sure. I'll really sort of piggyback on Mazin. I think one of the biggest themes that seemed to be consistent across both of the conferences was in relation to acknowledging the importance of non-clinical data, social determinant data, and being able to really provide for the needs of patient populations. That was very consistent. Equally, this notion of conversations around health equity and social determinants of health in general. But I think that in both respects, there was sort of, I don't want to use the word superficial, but I am a little bit of superficial examples that were given in many respects. And in part, I think that was due to just a lack of clear definitions on what we mean when we talk about health equity, when we talk about social determinants. The other thing is that, unfortunately, a little bit of it was a bit of more of the same. I think that what would have been nice of seeing was more of the how-tos. There was quite a bit of, conversations around data management, et cetera, but it didn't really point to anything exceptional in those that came out. And Mazin, I encourage you, Mazin, to comment on this as well, along with me, if you perhaps saw something different. But I would say consistently across the two programs, those were areas where I think there could have been more substance provided. There weren't necessarily any major aha moments. There was this acknowledgement of workforce shortage. Again, that was another theme that was very consistent across the two programs. I do believe that with VIVE in particular, because its intent was to focus in on chief information officers and information executives, that some of the more closed door discussions that were carried out there perhaps may have lended themselves to organizations feeling a bit more complete. But I think that both left the door open for opportunity for more questions to be answered than problems that were solved during the conferences.
Mazin, you want to add to that, or do you want to also highlight some of your on the
yes.
Go ahead, please.
Sure, absolutely. Thank you, Dr. Prem. And thank you, Fran, again, for highlighting another important critical area. Is, again, I think they should be more focused on, again, making content relatable to research, relatable to the communities. And I believe, yes, that's one of the areas that perhaps we as international delegations, and there was a lot of delegations coming in from Saudi, from the UAE, and again, it's important to understand that at some point, yes, HIMSS could be the best place to look at shopping for technologies. But I think there must be a drive to become more research focused in the areas of health equity, social determinants of health, and as well make it more relatable to the communities of patients, or bring in more academia into it, and that's to reflect as well some of the need from the international communities, like the Middle East and the Gulf countries, that are trying to shift from consumption-based, looking at just vendors to buy from, into research-based, into more production-based economy, specifically in healthcare, where you want to partner and bring in more research capabilities to build sustainable healthcare systems, bring in more workforce development. And I completely concur with Fran. I think the superficial aspect of it, it's relatable perhaps to the fact that it's more vendor focused, which is again fair enough with the sponsorship models. I believe what can be added is more substance when it comes to academia and research opportunities. And I think that could be another area of development and enhancement. And I've only attended HIMSS. I didn't go to VIVE. I would love to go to VIVE and get more exposure.
Mm-hmm. Well, I think you're spot on, Mazin. And I would add that perhaps the gleaming light here were in the conversations that were centered around policies and regulation, right? The public policy group or public government affairs team at HIMSS, I think they did an excellent job, brought in a lot of administrators. I think the biggest difference was that participants became part of the solution in those sessions. So it would have been nice, having delegates coming in from the Middle East, coming in from Latin America. There were a significant number of them. And I feel that there would have been more value add had those delegates been able to participate in those sessions more directly, and that had been more fostered and encouraged. Now, it's important to acknowledge that there are, I'm not here to speak for any of these organizations or events themselves, but as I understand it, the VIVE program was really more focused on administrative role. And that was only one of multiple tracks at HIMSS, right? I felt like it was a flashback to maybe 2019 or 2018 in regards to HIMSS. Yes, it was smaller in scale, but in terms of the diversity of topics and tracks that were available, I guess in many respects, having done 4 conferences in 3 weeks, yes, I feel very, very fulfilled, but I also feel a little bit unsatisfied, a little bit, like not satiated, because I feel as though, as Mazin described, there are a lot of very difficult conversations that we sort of began to introduce, but really didn't necessarily lend themselves to allowing us the opportunity to really problem solve. And that's what we need to get to. I think that's what COVID has left us with, is that need to begin to truly problem solve and to do so in collaborative manners. And I also feel like, number one, I don't like the term tequity. If equity is important, then say the word equity. Don't make it cute. And don't be hypocritical by creating conferences where community-based organizations don't have a role to play and can't afford to participate. That just feels hypocritical to me.
So, well, I do want to thank you both for attending these conferences and giving us your insights, particularly as it relates to tech. I know there are so many important and pressing questions, but as we, want to take a second to thank you both to add to this in terms of the real keys to achieving health equity. And I'm sure you're going to have a lot of discussion in the chat and subsequent one-on-one discussions through Zoom and so forth. So I want to leave it there and welcome Stan back to take this program to the next session.
That's fantastic. A great panel and really well moderated. Thank you, Prem, for doing that. And again, that's a topic that is deeply—
Thank you, Stan. Thank you.
That's a topic, thank you, Prem. And it's a topic that's deeply rooted in, certainly in the values and the ethics at HITLAB, and want to make sure that as we continue to discuss those sorts of issues, that we're getting not just the feedback from these leaders that we've had here, certainly Fran and Mazin, but also with the audience, and incredible participation from the audience. Keep up the chatting on the chat box. Again, we like to keep that open, and really do appreciate you all contributing through your comments and your discussions.